I'm Andrew Lamore from Brookings, South Dakota, and in my spare time I like to do gardening, reading, and cooking. The most recent procedure I had at Brookings Health System was removal of a kidney stone. I was getting ready for back surgery and the CAT scan revealed I had a kidney stone. So we did a preemptive strike on it, and I wasn't really having any problems with it, but they decided that it would be better to get it out before back surgery than while I'm recovering from back surgery. Prefer to have as much done locally as I can. I mean, I've had surgeries in Rochester and Sioux Falls and, this minor one in Brookings, but it's you're close to family. You don't have to worry about traveling back and forth if there's any complications or any problems at all with that. So I just live down the street on 3rd Street, so it's like it's in my neighborhood. And the people here are really nice, and they're competent, and they know what they're doing, and that, it gives you assurance, that when you go in for a procedure that you feel comfortable with the people that you know and that you have confidence in their ability to do it. Dr. Park was very attentive to, the needs that I had, being here, and he's here once a week from Sioux Falls, and he tried to accommodate the schedule that he knew I wanted to do it here. And so he tried to accommodate that as much as possible, and we were able to do that. They put this stent inside your ureter, and every time you go to the bathroom, there's a little bit of it, you feel it, and it wasn't as bad. It wasn't real bad. It's just more of an irritant than a pain. And, I did have some pain meds that I think I took a couple of times, but mostly I, just tough it out. So the thing that I appreciated most about my stay here this time was the fact my wife was there. They were very attentive to my needs. They were very, watching out to make sure I was okay as a patient, obviously, but they were very attentive to her needs too, making sure she was comfortable, if she needed anything, while she was waiting for the process to all play out. And I think that made me feel really good too, that knowing that, my loved one who is there, giving me support, is getting the support from the hospital. That to me is the picture I remember from this experience more than almost anything else. And the cooperation that I've seen and I've experienced between, the healthcare systems in our area, I can't imagine trading it for anything else, because it works. It really works. And I've talked to other people too who've told me that they are really appreciative of the fact that there's such a cooperation among the healthcare systems here. And I think that, again, gives you confidence if you're going to have some kind of procedure that you're going to be taken care of by competent people. Absolutely, yeah, I tell that to everybody, yeah. And it's like, if you're in the area here, it's Sioux Falls is not that far away. We know that. I mean, it really isn't. But if you can have it in your own community, and I've watched the Brookings Health System, grow and expand and improve year after year, and it's just so wonderful to have a good, strong community, health system that we have here, and you're in your own community. People can come see you. When I was in the hospital in Sioux Falls, I had friends from Brookings who would have loved to come down here, but it was a little inconvenient. I understand that, but they said, "I wish we could get down there," but their work and schedule and kids and everything else. So, but if it's right in town, they can bebop in and out of here, during their lunch hour or something, and it works. It works so.